just seeing if there's any rotation. Sometimes a little shift in the hips will do that in terms of how flexible you are in your with that movement. It's okay. Good. And bend here for me. Any pain in the low back or in the hip with that?
No.
No. Okay, bend. Hey everybody, it's Dr. Warren Kalkstein here at Kalkstein Chiropractic. I am with the CA Jordan today. I'm a chiropractor in Baltimore, Maryland, and Jordan is a chiropractic assistant in Baltimore, Maryland. We are an office that offers physical therapy, chiropractic care, dry needling, nutritional services. So there's a couple of different things that we do here. As well as we have a lot of CAs with different backgrounds, right? So you've got a history. Your father is the man. He's taken care of me before. He works over at Charles Schwab, and I've gotten to know him over the years, like since growing up. He's always been so kind to us. And then you actually came in when you were younger with a hip complaint. You were a runner, and where did you go to school? No.
Yeah, so I went to high school at Bryn Mawr.
Bryn Mawr, okay. Gotcha.
And then I ran track in college for 2 years at Rider University.
That's right.
Yes.
And so you had a hip injury when you were in high school, and then you ran for a couple years in college. Did the hip bother you at all in college?
It did.
It was a big contributor towards you slowing down and stopping, wasn't it?
Exactly.
Gotcha. That was a hard one. So when you had the hip pain, did you get a diagnosis when you were in college? Did you have something where they followed up with you and examined, maybe did an MRI of your hip or anything like that?
No.
No? Okay. I kind of lost track of you after that. I mean, I wasn't even in college when you were coming in, so you were a young one when you came to see us in the very beginning. So today we're going to do an exam on your hip. We're going to take a look at that and go through a little bit of a mini history as well in the process. Before I jump into it, where are you going now, and what brought you back into the office?
Right, so I'm currently at Rutgers University in my senior year, and I came back to this lovely office because they took care of me about like 8 years ago, maybe,
it's been a while.
When I had hip pain in the beginning. So my dad has told me you guys are all great. I kind of remember.
He connected us.
Exactly.
Okay.
Yeah.
And so where are you on your educational journey? So you're doing an internship with us for how long?
I'm doing an internship here for 7 weeks.
Okay.
And then I'm going to be finishing up my senior year and
figuring out where to go.
Exactly.
You've got different options, right? This is a big transition time for you might go into the sports med world. You might go into
pharmacy.
Yes. A little bit of a transition, right?
Yep.
So if you're a pharmacy tech out there, if you're working the world of pharmacy, comment below. Let us know what you think about your career choice in that world. It's definitely a different step away. It's a lateral move away from the sports med world, but all the same in the healthcare field, serving people, which is cool. And I think you'll do really well whichever direction you take along that journey. Yeah, you've got a good heart. We've really enjoyed having you here help out. Really a great helper. So let's go ahead and talk to you first. Where's your majority of your hip pain these days?
My right hip.
And are you still getting it at all, or is it only when you run?
I'm not gonna lie, I don't run that much anymore.
That's okay.
But I do feel it here and there when I'm standing for too long or walking for too long.
So with activity or prolonged activity, you notice pain. Where is the pain?
In the front.
Always in the front.
Always.
Never comes on the back side at all. Okay.
Never.
And does it ever travel down in the leg at all, or does it stay mostly around here?
Now it stays. It used to tingle down into my foot.
So sometimes pain, even from a joint in the hip, not just the low back, can refer down the leg, and irritation to it, and it's significant, can travel down. It went all the way down into your foot before?
Yes.
And numbness and tingling? Or was it just at your foot, or did it travel all the way through?
All the way down.
Gotcha. Okay. We're going to take a look at your low back too. Okay? So go ahead and face me and relax, all right? Let me see you bend to your right for me as far as you can comfortably go. Okay. Any pain in the low back or in the hip with that?
No.
No. Okay, bend to your left side for me. So I'm looking for the quality of the motion, how far she goes, where her barriers are on both sides. She moves really well with lateral flexion. Bend backwards for me. Good. And then I'm seeing if she shifts from one side to the other, or if she cracks her own back with that movement. It's okay. Good. And bend here for me. Any pain or discomfort with that?
No.
No. And then bend back for me. This is called a Kemp's test. Okay. There's a lot of different ways you can load the facet joints. This is just one of them. Any pain with that going that way?
No.
Any pulling or tension that was abnormal going either way?
No.
Good. Now come down and let me see you touch your toes. Good. And I'm just seeing if there's any shift at all in the low back. I'm just seeing if one ilium rides up a little higher on this left side. It does. And then come back for me. and just seeing if there's any rotation. Sometimes a little shift in the hips will do that in terms of how flexible you are in your posterior capsule. So I'm just keeping that in perspective. Okay, good. So you move really well with your lumbar spine. Okay, that's what I was really just looking at. Now we're going to take a look at that hip a little bit more too. Okay, come on your back for me. And that didn't cause any pain bending down at all?
No.
No, you felt good in that position?
Yes.
Yeah, you've always been pretty flexible too, right? What's up, Nick? Oh, you good? Dr. Nick behind the camera. Liam is off at art school, so we've lost our man behind the camera. We've gained a lot of other supporters. So I'm going to check both sides because I want to compare the two of them, right?
Okay.
And then you can kind of learn and ask questions along the way if you've got any.
Okay.
This could be
I
your
remember
world.
all of this.
Yes. Internal rotation,
Yep.
external rotation, looking at end range flexion on the joint. You move really well with this hip. I don't feel any impingement at all or restriction. I'm going to palpate the SI joint. Any pain with that at all? No. This is a figure 4 test. I'm going to put my hand on your right hip, okay? Any pain or discomfort in the groin or in the low back with that?
No.
No, good. Okay, and then I'm going to add a little bit of a modified test just because you're so flexible. Any pain or discomfort with that?
No.
Good. Okay, relax. I'm going to check her hamstring flexibility while I'm here and just see how her hip, low back, and just that posterior chain are moving on the left side. Now the right side. You got a history there.
Yeah.
You got a bone to pick with that side.
I know.
All right. Pen or pinch?
No, the pen's in my pocket.
That's going to give you some positive orthopedic tests if you got that jamming into your hip. And relax. Easy. And not any pain or discomfort when I push into that joint. It can be, no, it's okay.
Not really.
Not really, but you feel a little bit more pulling on the hip when I pull
Right.
it out that side. And do you feel it on the back side here?
No.
Where do you feel it?
Right. Oh, sorry. Right here.
In the groin?
Yes.
Okay. Did you have x-rays taken of your hip?
I did.
Yeah. Did you have impingement of the hip? Did they make any comment about the shape of the bone?
Yeah. So when I went into surgery, they shaved it down.
They did?
Yeah.
Okay. Did they shave the femur down or they shave the pelvis down? Did they acetabulum down or did they shave the femoral head? Do you remember?
The femoral head.
Okay.
Yes.
Gotcha. There's different types of pincher, right? And you can have this a little bit more where it's coming from the neck of the femur itself.
Right. When you go like that, I feel a pinch.
A pinch a little bit, and you can still get it, even though they go in and shave it down, it can just make you a little less symptomatic, but you can still get it. So what do we do with, it's called impingement, right, of the hip, right? I'm just palpating your low back and your pelvis now. Just feeling for the musculature. So when I palpate the front of this hip capsule, this TFL muscle, this is probably the biggest indicator that I've found of you so far besides the test for impingement on this hip, is the musculature around there is a little bit more aggravated. Okay, that can be painful right here, and it can cause a little bit of irritation to the front of the quad, and this muscle called your tensor fasciae latae or your TFL. Okay. So what I want to do with you today, okay, and we're not going to do it on camera because it's just going to be showing a lot more skin on Jordan's hip. Okay. If you'd like to get it done, okay, right, then we're going to talk about a treatment plan for this actually in the office while you work here so you can get a little twofer, learning, working, and get treatment. Is I'd like to dry needle your glute med and your TFL on your side, okay, and then I'm going to do some ART, which you guys can watch me do that, some soft tissue work, and then I'm going to adjust your pelvis because there's a little bit of restriction on this right side too.
Okay.
Okay?
Yes.
Does that sound good for you?
Yes.
You want to get that done? Have you had dry needling done on the hip before?
I have no idea. I think I've had acupuncture, but
Yeah, you never had dry needling?
I don't think so.
We weren't doing it when you were coming back here before.
Yeah.
So this will be first. It's really effective for this type of pain.
Okay.
Okay. And in terms of treating it, there's a couple stages that we look at. So this is a hip impingement video as well as a Meet Jordan video. And then I'll adjust you like I did last week. We'll do a full spine adjustment for you. So part 1 video is just an exam of an impingement on the hip, okay? You saw the lumbar spine move really well. She wasn't provocative of any of those symptoms. You saw a brief little history about her hip, and we got a little bit more important data there at the end that she had a little bit of a surgical history on this hip too, okay? And then we're gonna show you, I'm gonna show you where I dry needle her around the hip. We're gonna set the needles into the areas where there's tension and the musculature around. So this muscle here, your TFL, your glute med. I'm going to check your psoas muscle, but primarily the muscles that that are around the hip joint, front and back. Okay, and then we're going to do soft tissue work, ART is the technique that I'm going to use, and I'm going to adjust her low back. Okay, that's for treating this. That's the pain and mobility segment of where I'm going to get her better. And then when she's moving better, I'm going to really challenge her from a PT standpoint so that she can start to do some things again, like running or whatever she wants. That's something that you have to honestly, if you've had a history of surgery and you're still symptomatic like that, you just got to be always doing stuff to help out your hip, okay? Just so it stays healthy and you don't have anything that regresses backwards to what you had before. There's a lot more talking and less cracking on that video, wasn't it?
Yeah.
We weren't expecting that.
I know.
I wasn't. Okay, well, I'm glad. Let's get you taken care of the right way.
Okay.
And then to our viewers, this is Jordan. She's wonderful. You'll get to see a couple more videos with her going forward. Please subscribe.
Yes.